Hey, everybody. Good morning. Thank you so much for joining our webinar today. We're just going to give a minute for everybody else to join in, and then we can get started really quick. I'm sorry, I was in mute. Sorry about that. We're just trying to figure out my co-panelist, Wolf, is unfortunately facing some issues on getting on, some technical issues. So we're just trying to figure that out. Give us another minute, and hopefully we can get that going. Awesome. Hey, Wolf, can you hear us?
Yes, I can hear you. Let me make sure my Bluetooth is on.
Awesome.
Yes, finally got the
Zoom to work.
Awesome. All right. So without further ado, let's get started. I want to firstly, good morning, good afternoon, to everybody who's joining in for this webinar today. Um, as we dive deeper into how to turn patient data into patient care, I want to begin by doing a quick round of introduction here. So I'll go first, and then I'll give Wolf a minute to introduce himself as well. So my name is Nikhil Parwal. Uh, I'm a senior manager here, specifically on growing our partnerships and the growth side of the business for Lead Squared for our healthcare business. Wolf, do you want to go next and quickly do a round of introduction for yourself?
Sure. Hi, my name is Wolf Schlagman. I'm a Chief Telehealth and AI Officer for Healthy Young Minds. Been involved in healthcare technology as a technologist for 20 plus years, especially in the healthcare technology space in telemedicine, having been involved in building platforms for telehealth and using AI to scale access and delivery of care.
Awesome. Thank you so much, Wolf. I want to start by talking a little bit on the real world cost of intake errors, right? Which is mainly around demographic errors that cost, as we're seeing, it's costing more than $1 million today, right? Practices are losing money in revenue, either because of wrong data entry, wrong data being captured, They're not getting all the, fragments of the demographic information. A lot of practices are still today, which is shocking, are still, dependent on paper forms, and not really have migrated over to digital forms. Um, how has, and Wolf, this is, my first question to you would be, how has the way that practices acquire or are onboarding patients, how has that evolved? Obviously, like we still see a lot of clinics and practices still on paper forms, some that have already migrated to, basic forms today on the website. And what role do you think that data or information plays as a part in making that journey better today and for near future?
Sure. So what I find is there's a lot of providers out there who do the best they can with the solutions they have at hand. In some cases, they're using, their EHR as the main technology platform to provide care. Lots of them may lack the ability to really provide a more comprehensive solution to really manage all the needs to, one, acquire the patients, manage them, and engage them. The intake process, sometimes, you find and you'll see it's in many cases using multiple tools, all disconnected. If they're using, numerous tools to begin with. And in some cases, the HR kind of offers kind of some level of tools to engage, but it usually is very basic and doesn't really do holistically or comprehensively what you want. So you're just, in some cases have, major gaps. One thing I would also add is in many cases when they do use multiple solutions, and I think you're going to touch on this, it ends up having information in multiple solutions kind of, disconnected, and ultimately, creates, these data silos, or just really it becomes hard to manage things with using multiple solutions.
Agreed. I would second that as well. And for all the attendees, we have a quick poll on there. Would love for you guys to participate, and we would like to know, is your organization really using that data from your EHR or other places that you're capturing that to drive engagement? So yeah, please punch in your answers. We'd love to know more about it. Moving on to why most of the data never becomes patient impact, right? I think what happens is most EMRs or EHRs are mainly designed for just capturing, notes or documentation. And it's mainly just specific to that appointment, capturing what happened in that appointment. It's not really being carried forward from a perspective of engagement, nurturing, providing follow-up information. And a lot of that, 70% plus of that data captured is just basic demographics. Like we're not really capturing other key pieces of information that might help in their care journey or in their treatment plans. A lot of, like most of the EHRs were typically built for making sure that is most streamlined billing, and there were records that could be maintained digitally, but not so much for growth. Why do you think so many practices struggle to use them from an engagement standpoint, from a patient communication standpoint, or from a retaining patient standpoint?
Well, one thing I can add is, I remember when I came on with Healthy Young Minds, they were using, I'm going to say about 12 different solutions, all kind of disparate. And the EHR definitely didn't have a lot of capabilities to engage the existing population ongoing. They're using a separate kind of, kind of email software They're using a separate texting software, a separate telephony or telephone software. So everything was separate. So you really didn't know who was being called when. The appointment solution was also, in some cases, they're using 3 different ones. They need to make the appointment in the EHR. They're using, I think, Calendly and Google Meets because the providers were using one system in addition to the one in the EHR. So, definitely created lots of manual work, lots of disconnect, lots of issues. And so kind of streamlining everything and having one integrated system that can handle all those pieces, super important. And you find that the existing patients, other than the appointment that they came to, and to your point, the clinical data that's being collected through the EHR, the data entry and so forth, that's kind of the bulk of how the EHR is being used, and any type of ongoing engagement or nurturing of your patients just wasn't really happening. So part of the work with Lead Squared to make that happen, right? Some of the engagement and ongoing kind of automated engagement capabilities, makes that easier.
Yeah, and I agree. I think one of the most common challenges we see with practices that are coming to us with help, looking for a tool, the biggest challenge is that they're using isolated solutions, right? And there are point solutions being used for one just aspect of solving one particular problem in the entire for the entire practice, but none of it is tied together. So one data point is not talking to the other data point. It's very difficult for small practices to obviously have somebody full-time looking at data coming from 5 different solutions and figure out, hey, this can be used in communicating with the patient and building that out and knowing when to communicate what kind of information as well. So yeah, consolidating tools, consolidating data is definitely something that we see most often practices struggling with and coming to Lead Squared for help as well. So I think
Sure.
the point mentioned there as well, right? So manual tools, right? There's so much insight that is lost. There's so many delays in utilizing that information from an engagement standpoint. What are the most common disconnects between tools used for acquisition versus care, and how do these gaps hurt outcomes? Like, what are the main areas in your experience, and even with Healthy Young Minds before you guys bought on Lead Squared, what were the main gaps that were hurting in terms of patient engagement that you were able to fill?
Sure. So over the years, I've been involved in integrating into multiple systems via through my different companies that we had to communicate with, engage with different providers. In some cases, for ourselves, even using at the time like the likes of Salesforce, right, as a CRM, and it's very costly, also very complex. So for the average, kind of practice or provider organization, it's probably too much. But what I found with, for example, Healthy Young Minds is they had as me coming in and helping restructure the whole technology stack and really the whole solution set, going from a dozen plus solutions to one really that had all the pieces kind of integrated was kind of a revolution of sorts, because now people have to go from all this manual work and all this when I say manual, I'm talking about data entry into Google Sheets, multiple Google Sheets, using a separate intake solution, a separate scheduling, separate reminders, something, it really was completely disconnected. But you also realize how it happens because you start out with provider organization who they have been using an EHR for years, even if they moved to a new one the last few years, they lack a lot of capability. So what they find is, and this happens to me now, I am bombarded by providers who say, "Hey, you need to text your patients. Here's a solution. Hey, you need to email, engage your patients. Oh, here's another solution. Oh, you need to so forth and so on, right? Here's something for intake that helps to." So then they end up getting all separate solutions so they can fill that gap. But then they find themselves, 6 months, a year, 2 years on the road, having multiple disparate, disconnected solutions. They might do some piece of it, which is fine, but in totality or comprehensively, you kind of step back, you go, oh my God, like there's so many moving parts. And you also don't have the I'm going to say the benefit of seeing everything in all the communication, all the engagement with a patient or prospective patient throughout your whole, I'm going to call it patient or client journey, right? Which is pretty amazing. And then all the analytics and reporting that come from all that it just completely changes your business. Not only that, but also you can scale, right, your business. You can now potentially double the amount of patients without having to add, staff or, making your life so much easier because you're saving so many hours by automating a lot of it.
No, definitely. I think that makes absolutely a lot of sense. I think one of the key things that we try to tell most of the prospects and clients that we speak to is time is invaluable, right? And if you can bring in a solution, maybe like Lead Squared that can help you automate a lot of your manual processes and give back time that you can then in turn put in, talking to patients, providing them the care they need, uh, that's most important. And so let the technology do as much efficiency as we can bring in, and then we'll give you back enough time to take care of patients and fill those gaps.
Yeah, and then, we really didn't talk much about the patient acquisition side of things, but that whole piece of it of, potential new patients, potential new clients, being able to connect those pieces, which I'm sure you'll kind of touch on, really, is the other piece of the equation, right? You have this comprehensive kind of A to Z solution that is from the front end to the back end, meaning, you're having prospective clients that you're also automating the nurturing, right? The email campaign that goes out when someone has an interest for perhaps your services that you could kind of nurture over time with automated emails and texts. And you also have, the ability to call right from the system, right? You have this integrated telephony and texting and emailing. So it really does, I think, help with understanding, your operations so much clearer. And again, the data, the reporting, the ability to also get the data from the EHR back. When I say data, some of the demographics, for example, what appointments happen, back into even Lead Squared to say, oh, these are the appointments that happened. These are the appointments that got canceled. And then if something gets canceled, you can have automated emails go out. So you can really have, just a lot of the technology doing the work for you, right? Instead of, just having to do hours and hours and hours of just really manual work.
Absolutely agreed. Second poll coming up. Which of these areas is your biggest data blind spot today? Right? Is it intake and scheduling patterns? Is it no-shows and drop-offs? Is it referral tracking? Or is it follow-up automation? Right? Which of these areas are your biggest blind spot? You have no idea what's going on in this. So go ahead, put in your answers. Love to understand that well.
One thing to add is we're able to, the practice with Healthy Young Minds, they do some marketing with social, and they're able to take and track what happened when someone clicked on, let's say, Facebook or Google ads or whatever the marketing you're doing, and track the click all the way through to conversion. But once someone fills out a form on Facebook or what have you, it automatically goes right into the Lead Squared kind of lead system. And then you have this ability to engage, right? Automatic emails, messages go out, whatever campaign that you put in place. And then you talk about scheduling through the system, the appointments, the follow-ups, and then of course the emails, the thank yous, the reminders, all that in one system. So it really does, kind of simplify and streamline things. um, throughout the whole journey.
Absolutely. And I think another good point to also look at is especially practices that are spending money on driving, like in running Facebook ads or Google ads. I think knowing exactly what the outcome of that campaign was and attributing that to the entire patient's journey is essential to also tell the practice that, hey, maybe a Facebook ad is running better outcomes for you than a Google ad is. And maybe that's where you double down from a marketing execution standpoint, right? So I think that data tying in to being captured in real time, tying into the conversion taking place from the time somebody filled out a form to the time that they took to get an appointment booked to how much time did they take to get their care started. All of that becomes absolutely essential from a tracking perspective. All right. Drop-offs, right? I think another big challenge that keeps coming up in our conversations with prospects is um, patients will fill out a form, request an appointment, but not show up. Or, they came in for their first consultation, but, didn't come up again for their follow-up appointment. So what some of the most common blind spots that we see are, patient getting referred, but then dropping off in the journey, appointment no-shows, follow-ups being missed, forms not being filled out completely because they just dropped off, didn't bother coming up. So question to you, Wolf, is once care is delivered, where do you see and where have you seen most practices drop the ball? Is it in follow-ups? Is it in re-engagement? Is it in managing care gaps? Is it once the treatment starts? Where have you seen even in if this did happen in Healthy Young Minds or even in your previous organizations, where practices have ended up in that situation?
So one is, making sure that when you have a prospective new patient client, that you need to quote unquote convert. So to make sure they kind of show up. So making sure that they get the information that's needed, they get the reminders that are needed, all kind of built into what they're getting. Sometimes if you don't have some of those pieces, even as simple as, the reminders that come with, right? In some cases, if you don't have things set up correctly, I've seen, for example, beforehand where the EHR would have a reminder one day before. You have an appointment tomorrow at 4:00. You get an email. Okay, well, today is the day of the appointment. Oh, I forgot about it, or you know what I mean? It wasn't really, it'd be great if you could have gotten reminded that day, 15 minutes before, just something more, in a timely basis. One, two, when you have ongoing, kind of sessions, in the case of Healthy Young Minds, they do thousands of sessions a month, 100+ providers in multiple states. So you have to have the technology do the work for the humans, if you will, because you can't expect the providers to necessarily do all the follow-up or do the things, manually. It just can't happen. So if someone doesn't show up, there's got to be an automation that happens when that doesn't happen, that reaches out to the person, one, before the appointment happens, an hour before, 15, are you ready for your appointment? Those kind of things, to make sure that, you're not wasting a provider's time, because you booked the provider's been booked, right? Be it telehealth or even in person, and the person doesn't show up. And depending on the insurance, what have you, you can have sometimes people pay a fee, but many cases not. But having the technology be able to properly remind and also get confirmation that they're showing up. So having that built in is important. But when they do, when they're not able to come to the appointment, the ability to reschedule. So one of the things you find is some of these EHRs, which, I've looked at really probably 50+ EHRs in the top ones, and some of them just don't have even rescheduling capabilities. It's amazing. They just have a cancel capability. and you have to call the office kind of concept, which, some people may not do. They just go, no, cancel. So having the ability to give people this option to even reschedule, or but then to follow up and have the platform, the solution, follow up, oh, we're sorry we missed you, here's, when do you want to reschedule? Because again, the provider is not going to do it. And if you've got thousands of sessions that are going on a monthly basis, you're going to have people slip through the cracks, and then they don't get the care they need. So again, having the technology do the work for you to reach out and proactively, make sure people are going to show up, and the ones that don't or can't, those are also engaged with proactively.
No, that would make sense, and I would agree as well. I think most EHRs, and this was something we were talking earlier as well, right? Is EHRs were mainly built for just documentation, so they weren't really built for engagement. So if you're just leveraging your EHR, you're not going to know who you called, who did you not follow up with, who you need to reschedule with. So that kind of information definitely ends up becoming a big reason for drop-offs. And that's when a CRM can basically help in not only giving you that insight, but also automating that process for you. So you don't have to, have a note somewhere reminding you that, hey, patient John Doe had booked an appointment, but, rescheduled or canceled, and you need to call them after 2 days. The system can automatically think and, do that for you. Can you share an example, Wolf, where, your EHR, or now you guys use Lead Squared as your CRM, the insights that came out of there that helped improve your follow-up or prevent drop-off? Like, what changed as a result? What was the percentage change that you've seen? And how did that impact the overall sort of operations at Healthy Young Minds?
So because Lead Squared has the ability to trigger different actions, and in this case, if this happens, then do this. So if an appointment is, let's say, whether it's canceled, follow up with that, or after an appointment, you can also send them certain information, right? So we've done a number of integrations into Healthy Young Minds with Lead Squared, of course, the ability to have, from the EHR side, every appointment that's happening, we can have reports that tell us what appointments happen when, by what provider, so forth. What appointments didn't happen, we also get alerted, right? So that you can take action. If someone didn't reschedule, for example, proactively, engage them with email and or text with a link to then, reschedule, right? Things of that nature. So you found that, the number of appointments end up going up. I think last month they had their best month ever, right? In the number of appointments and sessions they had. And they really haven't done, I'm going to say, anything different per se, in regards to any other things, right? Proactively, other than, having the technology do some of that kind of work for them. So the fact that we can, have the Lead Squared system, especially the campaigns and the setup emails and the automated follow-ups happen through Lead Squared, and you have infinite amount of flexibility, right, to send them whatever message in whatever cadence you want, with whatever links to rescheduling or information, links to certain things, as far as just follow-ups. So it really does provide so much more flexibility. What you find with the EHRs, even some of the best ones, is that they have just the modules or the pieces they've added beyond the documentation just are very basic, and so they really provide just some assistance, but really not to the level that really kind of give you a more not just comprehensive solution, but what you ideally would want. You just have to end up sometimes just doing what they provide without really getting what you need.
Makes sense. All right, our third poll coming up. What's the biggest barrier to acting on your data today? What's stopping you from making the most of your data? Is it just that the data is fragmented across different tools? Is it lack of, staff time that's available? It just simply could be you don't know where to start because this data is all over the place, or the tools just don't talk to each other, right? That's a common problem that we were talking earlier as well, that the tools are so fragmented and so isolated in the way they work that data captured is not able to go over and talk to some other tool, and that could be a challenge that's causing a barrier. So yeah, go ahead, put in your responses uh in the poll. I think moving on to, we spoke about efficiency a little bit earlier, but how can efficiency equate to revenue, right? Without adding more staff, um, right? And bringing in small changes that can have bigger impacts, and kind of how can SaaS or bringing in a tool like a CRM can help boost that. So I think one of the things that we've seen from a data point is that the front office staffing gap in the US is north of 200,000, right? But on the other side, a practice that was able to leverage more on the technology side without having to add more staff, they grew from 40 to 4,000 inquiries using a CRM because they just leveraged automation better. They were able to track things better. They were able to optimize their marketing. They were able to optimize their acquisitions. So they obviously saw a lot of growth. What's the one simple workflow tweak or maybe an automation that's made a meaningful impact on both patient experience and team efficiency, both either in healthy young minds today or just in general that you've seen? Like, what's the most common workflow or automation somebody can introduce for a much better impact?
So again, I find lots of practices may not have, I'm going to say a really good CRM on the front end. So you've got one practice, new client, prospective patients that you need to manage. But then you also have, once you have someone interested and you're collecting information, you want the information to automatically go into the CRM, create the patient, and then be able to be connected to the CRM, because as you engage with that patient on an ongoing basis for the purpose of having the analytics, and you're going to provide care with the EHR on one side, but you still have a need for the engagement piece to be ongoing, be it newsletters, or again, you can use the reminders. So having that data that you have from prospective patients automatically go in with all the right information, what insurance they have, all the right information. Even LeadSquared has a verification, right, module as well, like with P-Verify, for example, right?
Right.
So you can, prospectively, verify, if someone is covered and what coverage they have and so forth, before, they even get into the HR, right? So, because there's no sense in entering all the information in manually once again and realizing, oh, you don't have coverage. Okay, what do we do? Erase the information now. So it helps to automate a lot of that manual work. And in some cases, we're dealing with hundreds and hundreds of new prospective patients a month, that you're kind of automating all that process. And then again, because you're, automating the engagement piece of it and the communication piece, because I want to make sure that piece is important. Every phone call, every text, every email, every call in, every call out, it's all there. So you can see exactly what happened, who took the call, what was the outcome of the call. And then you have different views or reports or views of who is at what stage of the process. So that's really so useful, because before you just have, just it could be paper, but in some cases, very rudimentary, very basic solutions that really don't allow you to scale, or really do what you want to do efficiently, right? So automating, a lot of that data going into the EHR, and then the EHR communicating back. So that has been very, very efficient, and has multiplied the capability, and saved a tremendous amount of time. So I think that, I would say, is a big piece of it.
Absolutely. And I wanted to quickly, showcase this part. And I know we've been talking about this right from the beginning of the webinar. I think this is where, Lead Square helps sort of streamline and bring sort of different processes and workflows together, right? As you can see, this is one example of our journey, like with EHRs like Advanced MD or Athena or ModMed. We primarily do this day in, day out, where we've tried to create like a very patient-centered growth journey. So we track everything that's coming in from either your social channels or your referrals or word of mouth, e-faxes, any place where patients could potentially find you. We are able to track all that information in, create a quick inquiry in the CRM. So the lead gets created in the Lead Squad system. It then transfers over after you've captured certain details, you've validated certain information. You have complete freedom to decide at what stage do you want to push that into the EHR based on our own process. So we can send it to the EHR, and we can obviously map the patient ID that's get created in the EHR. We move it forward through the insurance verification process. You mentioned about P-Verify, which is one tool that we use internally to provide an AI-driven eligibility and verification of benefits. We're able to run that query inside Lead Square as part of the workflow, and then push that information into the EHR as well, which then takes the patient journey to the next step, which is getting them the appointments booked, right? So either having the ability to fetch the available time slots from the EHR into the Lead Squared system, so users technically don't have to log into the EHR at all. They can actually just capture all the information in the CRM, run the eligibility, schedule the appointment, and that's it, right? And the information is automatically going from the CRM into the EHR. And then as we captured the outcomes of that appointment, right? Was it the appointment got completed, did not get completed, or even if it is just it got rescheduled, we can always put them back into that follow-up loop or a follow-up process. And we're tracking data at every step of the way. So that one system, one view technically is what we are trying to achieve for every practice, right? And so as we look ahead, what's the real opportunity in bringing a CRM and EHR together, right? Especially when it comes to delivering seamless, data-driven care across the entire patient journey, right? In my opinion, I think the real opportunity is leveraging the data and from every step or every milestone of the patient's journey, and using that data point to communicate back to them, whether it's sending them information, whether it is informing the referring provider or their case manager saying, hey, you sent us this referral, just wanted to keep you updated on the patient's journey so far, right? That's the level of engagement that will encourage them to send more referrals your way, or letting the patients know that, hey, this is what you can expect next in your care journey. Just make sure that you're keeping track of your medication, you're keeping your schedule up, and you're coming up for your follow appointments. So I think that is definitely one of the things that we are mainly focused on, is from a streamlining and from creating a very patient-centric journey.
Yeah, one thing I would add is, when you're dealing with certain types of practices, you might need one or more calls, right, to engage with that prospective patient, answer questions, and send them documentation to fill out. So tracking that process, right, the appointments, the follow-ups, the the rescheduling, all that has to be done somewhere, right? So LeadSquare does that very well. Then of course the conversion into patients, as you kind of point out, sending all that data in, and then the ongoing engagement that may need to happen. As I mentioned with Healthy Young Minds, we're using multiple solutions. On the telephony part was Vonage, I think it was Active Campaign, an email. They were using Zendesk, I think it was, it was just all these different pieces, and scheduling something else, other things. And so it again, it created such an issue in the intake process, where lots of disconnects were happening because there was lots that needed to be kind of handled or kept up with manually, that it just was, you had multiple people having to do the work of just really one person or part of a person, with the technology doing the work for you. And somebody was asking here, does LeadSquare have a widget to put on a website? Yeah. So we're using the widgets that are integrated into the forms that automatically go from, you filling out, you clicked on the ad on, let's say, Facebook, landed on specific pages. And one of the things you could do with LeadSquared, we found, is that you can have, multiple pages for even different partners, different referral sources. When you fill out the form, it automatically will give you the option to make an appointment right there with the right availability, times, all of that built in, right? So if you have certain people, certain hours, so it gives you the times of those people available, right? Because that's kind of built into the system. And so someone's asking about widgets. So yeah, so that's what they actually call it, a widget. So we're using widgets from them that are form widgets and appointment widgets built right in. And when we send an email out for prospects, for rescheduling, so forth, those are links to the, in some cases, the form widgets for appointment, rescheduling widgets. So yeah, so they have the ability to build additional widgets, lots of flexibility. It's like whatever you can imagine. Really, that's one of the reasons we picked LeadSquared, because they have a very robust, very simple to use platform to create and work with them. The things you need done, they'll also kind of create for you. Just tell them what you want, and they help in that process.
Yeah, and I think Patty also had a
So
question.
one of the things, yeah, I saw there, it's a patient that call in or show up in your clinic. One of the things we have, because one of the things I mentioned before was that I call it telephony. So if people are familiar with Vonage, or it's like a virtual telephone system, right? So they have a built-in telephony system. What does that mean? That means when someone calls in, what we're basically doing is forwarding to this new system. So when someone calls, it literally pops up the patient information, or if they're a prospect, right there. And so you're seeing what they called last, what email went out to them, who talked to who, what happened. So it allows you to know all the communication that happens. So any inbound call, it's tracking, and any call out, right, as well in the system. So every email, every text, everything is there. So and to use that telephony, all you're doing is forwarding really to that new system. They set it up, they set up the users in it and so forth. But that's also helped a lot, because again, not knowing, once you have many clients and different uh, office personnel, you have to kind of keep up with it, but the system really documents everything. So that kind of saves a lot of time. So that has been very helpful.
Absolutely, yes. And I think to answer the question in terms of, what and how to envision LeadSquare as a platform, I think it's everything to do with streamlining not just your scheduling, but your entire intake and acquisition process, right? It's identifying where patients are finding you from. Based on that, how can we streamline that journey from the time that they make that first reach out to you? Is it through their website? Are they seeing an ad? Maybe they're looking at a billboard ad and they're calling the number that you have there, and still letting the system identify that, yeah, this came in through an ad we ran on a billboard. Or, and being able to build out a process which is covering your information that you want to gather from them, whether you want to collect documentation, whether you want to get them to sign consent forms, whether they want to complete your intake packet, whether it's scheduling, and then the constant follow-up, right? Between each of these processes also there's certain level of communication. So all of that is something that you can envision Lead Square to be, that one all-inclusive solution, essentially, that can help you with that.
One
Which,
thing I will add is you guys use what I call UTM, the reporting and tracking. So
correct.
you mentioned, when someone clicks into the website from wherever, Facebook, it tracks that, right? So it tracks that it came from Facebook, from Google, from wherever they came from. So then it puts that as a source, right? So then the reporting says, these, out of whatever 100, leads or potential clients, 37 or whatever, percent or whatever it came from Facebook. And by the way, it gives you so much analytics, right? So you have all these various types of reports, that it's just it's, in some cases there's a lot there, but there's a kind of a set of reports that you guys provide, but then it's infinite what you could do with it. Someone asked if you guys have an AI chatbot. As a matter of fact, that's one of the things that we're in the process of putting in. They had this, I'm going to call it a dumb chatbot before with with Healthy Young Minds. So with just a simplistic chatbot, but with the one that we're integrating, it will kind of act very human-like, but it will ask the right questions and very collect data. What's your name? Hi, my name is such and such. What's your name? And I'm here to help you, such and such. Here, let's provide your email so we can send information after, and then make an appointment right in the chatbot. You can make an appointment, never having to leave the chatbot, for example, which is really cool. And so it really and it proactively, one of the things we're doing, it can proactively engage the person. So if someone's on your website for a minute or so, they is that, or 2 or 3, whatever you want, the chatbot can practically say, hi, notice you're here, how can I help you, and so forth and so on. So it takes you down a path, and then can, of course, direct the information, but kind of stay on with them if they want, right? So I thought that was very cool. So you're in the process of integrating that, hopefully by next month.
Awesome. Wolf, one more question for you. So we had somebody ask us how to ensure my whole intake team is on the same page with patient information being collected.
Yeah, so what we've done, and I think what Lead Square does that's very cool, is you have a dashboard. So every kind of member of your intake team or your front office staff has a way to see exactly what's going on with everyone. They call them views, but they're basically stages. And so you see along each stage where people are. So people are in the verification process. People are they're doing the called in the intake process. What they've done. They're ready for scheduling. Just there's, I think, 4 stages that kind of people go through. Once they finish, they've been verified already. Then folks can follow up for them to properly make an appointment, because sometimes that can be done very quickly, and sometimes that may take a day or so. So yeah, there's a dashboard, if you will, that has lots of information and the little widget or areas to tell you what's going on and who is, and you can see things in real time, but then you can get reports. So what happened last week, last month, year to date, quarterly, just a lot of analytics, which are, really, really great. Was missing before, big time.
Awesome. Perfect. I don't see I think we have one more question. Yes, awesome. How long is integration typically, and how many systems is typically needed to integrate with? So there are two ways that to look at this, right? It depends on how many essentially how many tools are you using right now, and what we do as part of our initial discussions with you is try to identify, do you really need all those tools working independently or integrated? Can Lead Squared replace some of those tools with native functionalities that we already offer you, right? For example, do you need a separate email marketing platform? No, you can do email marketing right from within the solution. Do you need a separate reporting tool? We can do reporting on our own. But essentially, the only integration that maybe you want to do an integration with your EHR or your EMR platform, or you want to do an integration with your RCM platform if you're using a separate one. Those are essentially that, depending on the complexity, varies in terms of how long it takes. For example, if you're using an EMR or an EHR that we're already on the marketplace with, we have, pre-configured integrations with, like, for example, with Advanced MD, with Athena, with ModMed, with Dr. Chrono, and so on and so forth. Typically, the turnaround time for that integration is between 4 to 6 weeks, for setting up, let's say, 2 or 3 bidirectional flow of data, depending on, of course, if there are more fields of information that you would like to bring between both systems, we can obviously dive a little bit deeper, but that's typically 4 to 6, upwards of not more than 8 weeks is what we've seen typically, our integrations to take time, essentially.
Yeah, one thing to add is, from the moment, so a couple of things. One is, you want to do kind of an audit, right? Of, okay, what do we currently have? What are our systems? You have an EHR. Are you using a marketing tool that's separate? Are you using, in some cases, you may use a separate solution for texting or, okay, so the idea is you're going to replace some of these solutions with Lead Squared. So what we did, and the way kind of I drove the process, which I imagine most people want to do, is you're going to do things in parallel. What does that mean? There's the forms that are going to be set up. So there's a bunch of templates that they have, but we of course customize a little bit of a workflow in some of the forms. But out of the gate, you're customizing, the initial kind of I'm going to call it demographic forms as far as information, little widgets, the things you're going to use. If you decide, oh, we're going to use the email system, the automation to send emails, great. Those can be, if you already use some of them, they take them and put them in their templates. So some of those things can be kind of be worked on in parallel while they do the integration with the EHR. So as you move forward, you go, oh, hey, yeah, we want to use this telephony system. Okay, great. So you decide that there's 4, 5, 6 modules from Lead Squared that you want to use. Numerous of those can be done in parallel. So ideally, could be 8 weeks or so, depending on, as you said, the complexity. And also you're dealing with the other side of in the EHR, they have to, do their part to the integration. But a couple months or so to integrate a number of, the pieces concurrently. And I think within, 8 weeks, and it could be 10 to 12 weeks to have this full integrated solution. But in the meantime, it's being worked on. You're kind of continuing to do business as usual. And when it's all kind of connected, all working, what have you, you're then doing the switch, right? Which, it's pretty seamless, or was pretty seamless for us. There weren't really any major issues, a few little tweaks that need to be done. Nothing major whatsoever as far as in our experience.
Perfect. We are almost on time. Any other questions that I may have missed or I and Wolf have not been able to answer, feel free to reach out to us. And we'd love to continue our conversations with everybody who's who's here, talk a little bit more about Lead Squared, how we can help you understand your nuances, your processes, how your practices are doing things differently. and hopefully get a chance to work together. I want to take this time to thank Wolf for your time, for joining us today and sharing these insights with us and everybody who's attending the webinar. For everybody who's attending, thank you for taking the time and joining us today, and look forward to more such interesting insights and that we're planning over the course of next few more webinars. And you'd hear about them, and you'll hear about our communication, and we love to see more participation from people like yourselves, and we'll bring in more cover more wide variety and more range of topics pertaining to how we can make the life of practitioners easier. How can we enhance patient experiences, patient engagement, and the overall care journey? Once again, thank you so much, everybody, for joining today. Thank you so much, Wo, for your time. Have a great rest of the day. Have a great weekend.
Thank you. Take care.